Mary, I appreciate your question, but the worst thing we could do, in my view, is to expand Medicare for everybody in the country. Why? Because $51 trillion underfunded liability exists today for the Medicare we have. Here's my question, Mary. When I retire, I'll have a military retirement and I'll have congressional retirement. Why should Medicare be the primary source of health care for me? To me, Medicare should be the secondary form of payment. I should take my military retirement and all the benefits I've incurred through my life, and that be my primary way to deal with my health care and retirement, and Medicare should be the secondary system. Why should Part D, the prescription drug provisions in Medicare, buy prescription drugs for me when I'm going to make over $100,000 in retirement? So what I'd like to do is make sure that Medicare stays solvent, that we means test Medicare Part D, and that we have more opportunities to have health care in the private sector and not consolidate it. If the Obama health care law becomes fully implemented in 2014, 29% of the people in South Carolina will be Medicaid eligible, and the second largest expense in the state budget is money to match federal government requirements to get Medicaid dollars in South Carolina. If Obama health care becomes fully implemented, that's $1 billion more South Carolina has to come up with. So I'm not for consolidating health care at the federal level. I'm for more private sector opportunity, medical malpractice reform, buying health care anywhere in the country, buying across state lines. And when it comes to retirement, I'm for the health care that we have in our working years following us into retirement, and Medicare be there for people who have no other choice or no other options, and it be there for people who are in the moderate low income levels, and people in my income level. Medicare should be a secondary form of payment. That's what I would like to see.